How are you? Zamor. Zamor.
Thank you.
All right, so and they are very, very friendly and very, very knowledgeable. And their support to us was incredible. And of course, we're here to teach and make them do better and perform better in different procedures in cardiac surgery, in the OR, in the operating room, and in the after operation. So definitely our interaction with the Zimbabwean doctors is very positive. They are helping us in each step, and we're helping them together. So it is a win-win situation for them and for us.
Was this a once-off or any chance of you guys coming back?
Actually, we never do a one visit. It is we're planning to start a sustainable program, which will coming in a few years. Actually, we're starting to plan the next visit. Either we'll do it somewhere in second half of late first half of the next second year, or somewhere April, maybe July, depends on how we can get the things ready and funds available. So we're doing at least one next year. Most of the funds is ready, so but we need some administrative arrangement. And as you said, as we always say, it's not a one shot, it's not hit and run thing, as they say. No, we're here to stay. Not to stay, but here to make the people here, not the people here stay and get stronger. Because if they get stronger, will not be coming anymore. It will take a while. We're planning to something like 2 to 3 year program of biannual visits to get the team here established. So it's a long thing.
We as Charmaine's parents, we are very pleased because of the assistance that we have received. Because we didn't know where we were going to get the money to let her go outside for that treatment. So we are very pleased for this. Thank you so much.
How old is Charmaine?
Charmaine is 2 years old.
And for how long has she been battling the heart condition?
Since she was born, she was battling with this problem.
So what challenges was she encountering day to day?
Okay, she was having difficulties in breathing, and from now she can't even walk at the age of 2 years, but she can't walk. But we're expecting that after this operation, maybe she's going to be here.
Any words for the team, the medical team?
The medical team, I want to thank them very much for the effort that they are doing.
And your full name and where are you from?
My name is Tafros Madon. We are from Mutare.
Thank you very much.
The relations between Zimbabwe and Egypt is actually very since the time of independence and before independence actually. Egypt had supported Zimbabwe in its liberation struggle, and we continue to of course support Zimbabwe because Zimbabwe is our African sister, and we I believe always in African solutions for African problems. And this is not only my personal point of view, this is the government of Egypt point of view. We are cooperating in many themes of cooperation, and I would here speak about the cooperation in the medical field. The Egyptian medicine is already here in Zimbabwe, and it's actually in all the government hospitals, and we are continuing to send more shipments here for the patients here in Zimbabwe, and as well as, of course, we are very ready to assist in all the fields of cooperation for surgeries and in different fields. And this is now we are receiving the delegation from Egypt, medical delegation from Egypt, headed by Dr. Cham Shawi. He's a very renowned surgeon surgeon in Egypt in the field of open heart, and it's something that we're very proud. He and his team are very well seasoned doctors, and this is actually the beginning in my point of view. I am sure that we can do more because as I mentioned, there is always African solutions for African problems, and this is the actually commitment from our president to all African countries, and of course to our sisters and brothers here in the
So this is our first camp with the team from Egypt, and I must say it was a very successful camp. Our aim was to operate on at least 10 patients, which amounts to 2 patients each day. We have managed to operate on 10 patients, and this is where we have ended. And I'm happy to inform you that all the patients are doing very well. They managed to come from theater without any mechanical ventilation, so they are breathing for themselves. They need very little support, and they are doing very well. So we are expecting that within the next week, most of them will be going home.
All right. And how the prevalence of heart conditions among children in Zimbabwe, how is it?
So for every child born alive, 1 out of every 100 will have a congenital heart condition, which is amenable to surgical therapy. So if we look at our crude death rate, we are looking at least 4,500 children born in Zimbabwe each year that have this condition. And cumulatively, because there have been very little surgeries done, it becomes quite a large number. But I don't have an exact figure offhand at the moment.
Okay, and then Doc, I understand last year we resumed open heart surgeries on adults. So is this now the start of pediatric heart surgeries?
So this is the start of, yes, congenital heart surgery. I must say we did do a patient with a congenital heart surgery. It was a bigger child, but this is the first time we've now started on the smaller children. And we are going to continue operating on these children from now on. We have managed to refresh and see what we need. We obviously have to replenish our stocks and so on, but we will be continuing with open heart surgery on children, on younger children from now on.
And in terms of capacity to conduct open heart surgeries, in terms of the staff, are we well equipped in the event that we can continue without the support of the Egyptian teams?
We obviously will need a lot of support in terms of the manpower. Our main limitation has been intensive care unit staff. So ideally, we should have an independent cardiothoracic intensive care unit. And ideally, to keep a single surgeon competent, we should be doing 150 open heart surgery cases annually. So we are looking at doing at least 3 cases per week to make 150. So it's obviously going to be a process, it's not going to be an event, but this is what we are working towards, and we are working with our administration here in Paediatric, at Head Office, Minister of Health, and we'll continue to develop our relationship with the Egyptian team that has come, and we'll send a lot of staff for training.